Welcome to Public Health Sciences at Hamline University. I'm Professor Susie Keefe in Public Health Sciences and Sociology at Hamline. My background is that I have a PhD in medical anthropology from Brown University, where I specialized in Africa, reproductive and sexual health, and marriage.
And hi, everyone. My name is Lisa Stiegel. I'm a professor also in the Public Health Sciences program. I am also teaching and doing research in exercise science and in the biology department as well. I did my PhD at the University of Texas at Austin in exercise physiology with special concentrations in nutrition and exercise immunology. So today we're going to be talking with you about the Public Health Sciences program at Hamline and what sets it apart from other programs. So what is public health in general? Public health is really a broad and complex field, and the American Public Health Association defines it as promoting and protecting the health of people and communities wherever they live, work, learn, and play. So public health is all around us all the time, as you can see in this picture. You may be familiar with public health, especially given its important role in controlling the COVID-19 pandemic. So what kind of jobs are available in the field of public health? Well, as previously mentioned, jobs such as epidemiologists and virologists are really important in controlling infectious disease outbreaks, such as what we're seeing with COVID-19. But there are many other important roles as well. Public health physicians and nurses, first responders, but also community planners and community advocates, social workers, public policymakers are very important to this field, as are researchers, scientists, and health educators, and many, many more. As you can see on this slide, the job opportunities are as broad as the field itself. So Hamline's approach to public health in terms of educating students is very distinctive. We have an emphasis on applied and community engaged learning and research, as you will see in the rest of our talk. Internship experiences in the field are integrated into the major, and students have the opportunity to do collaborative research one-on-one with a faculty member or do research in their courses, as you'll hear about in a moment. There are other opportunities for research too, such as honors projects, senior theses, and many of our students go on to present their work at the National Conference of Undergrad Research. One thing that makes us really unique is the opportunities to work closely with our faculty members, as you will hear more in a moment. So I will show you a little bit about our major in terms of the courses that students take. So on the left side of the screen, you'll see required courses such as the Introduction to Public Health course, which sort of serves as the foundation, epidemiology, infectious disease, statistics, research methods, of course the internship I mentioned earlier, global health, and then a senior seminar, a capstone course that ties things all together. We also round out the electives within the major to cater to students' interest and what they think they might want to do after graduating from Hamline, be it graduate school or go into the job force. So electives can include things like special topics in health equity, nutrition, health and the environment, cultural politics of global health, reproductive justice, and many, many more. It's important to know this is an interdisciplinary program in many ways, so electives can come from psychology, sociology, social justice, political science. So lots of options for majors with many different interests.
Okay, we wanted to give you some examples of how students are engaged in research and applied applications from the field of public health. And so two courses where we see that happening quite a lot are senior seminar and the special topics and health equity courses. So students will spend the semester working with a community partner to conduct public health research on a specific topic that is important to the community partner. And here you see the last 4 years of options that students have been able to participate in, working with the Minnesota Department of Health, the Twin Cities Mobile Market, Family Tree Clinic, the Urban Farm and Garden Alliance, and this spring we're working with the New York State Department of Health AIDS Institute. And so students who take these classes get a chance to really experience hands-on public health in action and do research. So one example is in the fall of 2017, we partnered with the Minnesota Department of Health around concerns with mercury poisoning that was happening in St. Paul, Minnesota. And that was a sort of, at the time and even continuing today, considered a mini epidemic of mercury poisoning associated with using skin lightening creams. And so the senior seminar conducted focus groups with among community members to understand what was happening in the community and what was motivating the use of the skin lightening creams to develop a public health outreach campaign for the Minnesota Department of Health. And when we partnered with the Minnesota Department of Health, it was understood that they were excited to see what the students would do, but didn't necessarily imagine that they would result in anything that they could use. And in fact, as you can see in the bottom right-hand corner, the branding and the logo that the students came up with, as well as public service announcements for the radio, have been implemented and used as part of their public health outreach campaign. For a handful of students, the work continued after the class. They've given professional presentations locally and nationally, and also wrote a manuscript that was published in the journal Mung Studies. And that's a really unique opportunity for an undergrad to be able to publish. The work continues, and the Minnesota Department of Health really highlights the outcomes of these work as a successful collaboration between an undergraduate university and the Department of Health. Here you see our health and environment class, which has occurred in 2017 and 2019, partnering with the Twin Cities Mobile Market. Students got to volunteer on the bus, which is a mobile grocery store that goes to communities that don't have grocery stores and access to fresh foods. Then the students designed outreach around food insecurity for the bus. And here you can see the students volunteering and then also with their community outreach. One of the examples from that was students designed a social media platform for the Twin Cities Mobile Market. They called it the Humans of the Twin Cities Mobile Market, which if you follow the Humans of New York, it builds off of that idea. And so students interviewed people who were using the mobile market and people who work on the mobile market to help create sort of continuity and connection with the community. And here you see the 4 students who came up with that idea. And the really nice thing about that is that the Twin Cities Mobile Market then used that social media campaign for the next 6 months in their social media. So that project lived on. And most recently, the reproductive justice class is partnering with the New York State Department of Health. The New York State Department of Health AIDS Institute developed a comic called Tested, which is available online, so it's digital, and it has a diverse cast of young adults who are affected by HIV, STI, substance use disorder, and other public health issues. One of the exciting things is that as New York City has been really impacted by COVID-19, the AIDS Institute is the most recent sort of branch of the Department of Health to work on an epidemic caused by a virus. And so they've led a lot of the efforts around COVID-19 in New York. And one of the things they've done is they've been able to pivot the comic to address COVID-19. And so the bottom image you see here is Sex in the Time of COVID. And so they have released comics with the same characters and the same plot, but really how those characters would address COVID-19 in their lives. And so the students in the class have been able to be a part of that. They are doing and developing public health outreach and curriculum with our community partners. And so as we have shifted, they have also brought in those COVID-19 comics in response to the pandemic.
So now we'll talk just a little bit about our research specialties. So I direct the Integrative Physiology Laboratory at Hamline, and my research focuses on the relationships between aging, exercise, and health outcomes. So primarily I study the relationship between physical activity and lifelong exercise and its role in promoting healthy aging, particularly around physical function, as well as cardiovascular health and fitness. So often I use masters athletes as models of healthy aging and look at hormonal responses to exercise, as well as cardiovascular fitness markers with exercise, as well as functional mobility indicators as well. As you see in the picture on the right-hand side, a student measuring flexibility in an older individual. We often measure balance and aspects of fall risk in the elderly as well. This summer, we'll actually be working on a project where we're looking at the association between exercise and activity levels and prevalence of COVID-19 symptoms or diagnosis in older adults, both active and inactive.
My field is anthropology, and I do my research in Tanzania. And so I have been working in Tanzania since the late 1990s at the intersection of health and East Africa on topics of gender, religion, culture, and intimate relationships. Here you see some photos of me and my field site. And much of what I do is engaging women around their intimate relationships, their marriages, the divorces they experience, the role of polygyny, and how those connect to broader health questions, right? So decisions about when to get divorced or whom to be married to or how to navigate those relationships have really deep consequences for people's health. And so I'm exploring those topics.
So now I'd like to spotlight some of our students and tell you about the things they have achieved and where they are now. So we'll start by highlighting Ruth Shelton, who graduated from Hamline and is now about to finish her Master's of Public Health plus her Master's of Social Work at the University of Minnesota. Ruth has a focus on maternal and child health, as well as health, disability, and aging, and is working with the Wilder Community Center for Aging. She also is a birth doula and has a lot of experience around sexuality education as well.
Next, we have Bettina Schneider. She graduated in 2018 with her degree in public health and is just finishing her master's in public health at NYU, where she has been in the global public health program with an emphasis on epidemiology. Some of the projects she's been able to work on there involve behavior communication changes for global epidemics with UNICEF in Lebanon. And then recently, she's been in China working on the impact of climate change on health. And all throughout her master's program, she's worked at the New York City Department of Health and Mental Hygiene on emerging microbial diseases. She was one of the seniors who worked on the Hmong Skin Lightening Project and the publication and presentations, and really used that experience in her master's work. Mike Zhang was also part of that senior group that did the Hmong Skin Lightening Project and publication. He graduated in 2018 as well. And one of the exciting things for our program and for Mike was that he was able to leverage that research experience and the partnership with the Minnesota Department of Health and the Pollution Control Agency to get a job. And so he's an environmental specialist with the Pollution Control Agency and continues to work on the impact of mercury in communities in St. Paul and Minnesota, and particularly using his experience with community engagement. Emily Lincoln graduated in December 2019 with distinction in public health and political science. She was part of a health equity class research project on patient perspectives on health equity, which was a photo, voice, and participant observation study with a local community partner, the Family Tree Clinic. And that actually was published this past year in the Health Equity Journal. And then she also took on independent research on microaggressions experienced by student athletes of color at Hamline. Because of the experience of doing research in the class, she was excited to take on her own project. She's had a number of internships, one of which led to her job since graduating, which is as a co-leader of the GrowRx prescription gardening program with the Urban Farm and Garden Alliance. Next is Raiga Sese. She's a senior this year, graduating in May with a degree in public health and political science. She's also a Truman Scholar in 2019, and she will be entering the Center for Justice and Law at Hamline as a fellow next year. She's been involved in a number of research projects since joining the program at Hamline, including several that have led to publication and several manuscripts that she's working on. And she just successfully defended her department honors project on the political determinants of health, which was a collaboration with the Minnesota Department of Health. She's had a number of really exciting internships that were local, but also two that were national, one with the Center for Disease Control and one with the Robert Wood Johnson Foundation. And she's also been on two distinguished committees in the Minnesota. One is the Minnesota Public Health Association, and the other is the Cultural and Ethnic Communities Leadership Council with the Governor's Office.
Riley Geistfeld graduated in 2019 with double majors in both public health sciences as well as psychology. And she is now entering the University of South Dakota's Doctorate of Occupational Therapy program. I mentioned earlier that internships are an integral part of our program, and Riley conducted an internship at Functional Kids Clinic here in the Twin Cities area, and that really solidified for her that occupational therapy was her path forward. So she was able to do community engaged research and focus groups on the topic of barriers to parent engagement at Hamline Elementary School. And from all of this, she came out with the career goal of promoting health equity and mental health promotion through her career in the occupational therapy field. And we also have Allie Eastman, who has done research in many different areas. Allie will be graduating this spring with double major in exercise science and public health sciences. She will be entering the Master of Science program in exercise physiology at the University of Kentucky in the fall. So Allie conducted research with me in my laboratory last summer looking at beetroot supplementation and its effects on blood pressure in healthy female masters athletes. She also conducted research with Professor Keefe, working with the Feed Your Brain campaign. And she is now working on a pilot study with firefighters with another one of our faculty members, Dr. Jen Robb. So as you can see, our students get a broad array of research experiences if they so choose. Allie has been accepted to present her research at 2 conferences and is currently working on a publication for a peer-reviewed journal based on her beetroot supplementation work with me. She has a lot of great internship or leadership and other experiences at Hamline, from her internships to her involvement as a student athlete. As you can see, she was captain of the Hamline women's soccer team and also works with our Hamline peer wellness education team as a lead. So as you can see, our students have been very successful in our program. So we thank you for your interest in our public health sciences program.
And we look forward to seeing you on campus.